We need to meet the public in the communities that they live. We need to meet all people. So we need a diverse workforce so the workers in public health look like the communities that we're serving, that they can speak the language, that they understand the culture.
When you have a diverse workforce, you increase the likelihood that someone like myself might be able to connect with a specific community or group and help relay public health initiatives and messages in ways that are just a little bit more easier to understand or empathetic.
We need to make sure that we're working hard to reduce barriers that might stand in the way so that the public health workforce actually looks like the rich, diverse American community that we have.
The public health workforce has been under-resourced for decades. We saw that unfold during the pandemic in a really big way. We need to take that lesson learned and apply it. Because again, if you have a strong workforce, then you in fact will have the prevention that will save the dollars because we are out of control with healthcare costs. Philanthropy has an incredible role to play in advancing public health and helping the workforce. We've seen that play out specifically in the state of Indiana, the Fairbanks Foundation that led to the legislature this spring unleashing new state funding for local public health in the millions of dollars. Philanthropy's just got so much power, but it's more powerful if it's with a vision for the outcome that our nation needs.
I lost my job during the pandemic, and while I had that time, I wanted to do something, and I just didn't know what that was. I knew I wanted to help, and finding Public Health AmeriCorps, for me, gave me the tools and the knowledge and gave me the confidence to get out in the community and make some effective change. I was able to get out in Skid Row in Los Angeles and bring resources to them, COVID tests, vaccination, scheduling, and information on how to access vaccine clinics, food distribution, really bring those, all these different important initiatives to communities that are, again, hard to reach.
AmeriCorps is the federal agency for volunteering and national service. We have about 200,000 AmeriCorps members and AmeriCorps senior volunteers that are serving in more than 40,000 locations across the country. And so as we look at the gap in the public health workforce, 80,000 missing workers, we saw this need to address the urgent issues that communities are facing right now, but also to build this pipeline to make sure that we have community health workers in the future. We are moving more AmeriCorps members today to address urgent local health needs, but we're also building the career pathways. And so we're doing training while you're serving. You are learning and serving at the same time. We now have about 3,000 Public Health AmeriCorps members on a path to 7,000. And we not only are going to make a difference right now in communities, but I believe we're going to change the face of the public health workforce.
I really would love to see the day that we have a diverse and well-trained workforce in public health that can really put into action the power of prevention. The truth is, if we lift all communities, we lift everyone.